medicines in New Zealand we can purchase for about a third of the price they do in the States and about half of what they do in Australia. And some of the provisions of the TPPA we anticipate will affect the way that Pharma operates under this idea of transparency, greater transparency, and just even the provisions concerning patents. The tightening of the patent laws and what they apply to, etc., will make it much harder for generic companies to be manufacturing drugs, and therefore that takes away, one of the main things that Pharma is able to use to get, cheaper medicines for New Zealanders. So that's a primary reason. Another reason, of course, is the ISDS clauses, that basically undermine the sovereignty of nations. That is just what's happened in Australia with the tobacco companies challenging their public health legislation. You're very frightened that exactly the same thing will happen in New Zealand. There's a lot of moves to tighten up tobacco legislation, control of tobacco, and also control of alcohol. And where the ISDS clauses mean that those private companies that are applying these wares that actually are a health risk will be be able to sue our government if they change the law. But of course, it is probably not going to get to that. Just the chill factor, just trying to, politicians will be too, wary to and too worried about the consequences to actually bring in any the public health legislation and control of those products that it might want to do.
Steve, you need to speak on the.
Okay.
Hold on a second.
Have you been? What kind of information is being
invited to? A lot of the negotiations for these big, trade treaties, and that hasn't always been the case in New Zealand with these rounds, and it's complex, and our newspapers have not really picked it up very much. There's the odd article, so there's been a reluctance really to fully explore the issue. And I work for the New Zealand Nurses Organisation, and we, along with basically all the other health practitioner organisations and lots of other, the Public Health Association, the Medical Association, etc., asked our Health Select Committee if they would hold public hearings so that we could, raise these issues and discuss things, and that has not been extended. There's no public forum, basically, except for small groups or organisations like NZ No that have tried to start some public debate. So.
And how would this TPP, if it's implemented, affect the nurses and other healthcare workers in New Zealand?
Well, as you know, nurses are the face of public health. They're the people that interact with the public most, and there's never enough money in health, is there? You can never access all the medicines, you can't access all the treatment, you can't access, all of the things that you want. So it's always, you're always trying to get more. So anything that makes it more difficult to access medicines, that will make medicines dearer or more expensive, which is exactly what this will do, actually means that that people will miss out. There will be less money to go around. I should say that Pharma, our pharmaceutical purchasing agency, they operate to a fixed budget. So it doesn't change, it's not variable. They've got a fixed budget, and if the price of one medicine goes up, that just means that they won't have access to the rest of it. and not being able to legislate for for healthy lifestyle choices, not being able to control things like tobacco and alcohol, to put maybe restrictions on advertising. For instance, advertising of unhealthy food at, during children's viewing programs. I mean, presumably that those things would also be subject to appeal, and that would make it less likely that they would make those sorts of decisions. So as well as not being able to access the cure or the treatment, the medicines, we won't be, we'll be doing nothing, or not as much as what we should be doing, to stop people falling into those poor and unhealthy lifestyle choices. So it's a double whammy.
And what do people in Australia think of the American healthcare system? Are they aware of the fact that millions of Americans are not covered by healthcare, 63 million? And the dangers of that?
Yeah, in New Zealand, you mean? Yes, I think that's we're different, Kind of a little bit like Australia, like the US and Canada. Got things in common, but different. We're better at it. Absolutely. I mean, I feel a bit bad saying this, but, if we want to say that a health system is unequal, inequitable, unfair, and sort of, bring up a bogeyman of a bad health system, that's what we use. We use the US. We can't...
What do you want to do with that here?
I know, but it is true. I mean, I think Grant Robertson, one of the Labour Party MPs, but for as long as I'm quite old, and for as long as I can remember, a repeated refrain from our politicians has been that at some stage in their life they've been to America and they've seen somebody have an accident or something, and the ambulance draw up and somebody asks them what health insurance they've got. Like, that's the first question. Like, they're not helping somebody that needs help. They're asking them about their health insurance. And that's sort of just the epitome of irrationality and unfairness. And so, yeah, I'm sorry about that. It might not be as bad as that, but that's the feeling. We have got a public health system. We've actually got...
It's worse, people are saying here. It's worse, people are saying here,
Even
actually.
when you have insurance, you don't get care.
If you don't have insurance, you don't get care.
Even if you do have
Insurance, you still can't get your full care.
Yeah, I think that was what Michael Moore's that film Sicko was about. That highlighted that very well, didn't it? That the people that thought that they were covered and therefore didn't have to worry, in fact, weren't covered. Yeah. We also, I should say that we also have something called ACC over here. So that it's rather bizarre in a way, but that was a no-fault system, so that if you had an accident at work or anywhere else, you're covered for your treatment and compensation and rehabilitation if you need it. The emphasis is basically on injury prevention, rehabilitation and compensation. But what that means is that sometimes it's quite, which is marvellous, because you don't waste any money fighting out battles in the court as to who's responsible and who pays the bills, because these are all covered by levies, and if you have an accident, your health care is covered, but it does leave you in a rather unusual situation that somebody that has got, say, maybe can't walk because they've had cancer or something, will not get the same sort of treatment as somebody that has had an accident, not get the same financial help as somebody who has had an accident that's affected their mobility. So
maybe you can talk about the politicians who are pushing the market ideology. I mean, New Zealand, Australia have had strong labor traditions, and it seems like this marketization that the market will decide has taken over governments in these countries where this was fought by the people.
Yeah, absolutely. Unfortunately, in the 80s, we had what we call Rogernomics, which was the beginning of the end as far as we're concerned, and that was sort of continued right into the 90s and didn't really get a stop until 2000. And things sort of, we started to move a little bit back towards that situation. But the last two elections, we've had a national government, which is a right-wing and very market economy type of government, and they are hell bent on bringing in, a so-called market economy. A free market. It's not free for anybody, except for the multinationals, really. And I have to say that up until the national government was brought in 2008, there was always Pharma was always off limit. It was ring fenced for free trade agreements. So everybody could see that Pharma, being able to purchase cheap medicines was absolutely essential for New Zealanders, because we don't really have a big pharmaceutical industry here. And all of a sudden, just in an announcement, the Prime Minister said, we have to consider everything for the TPPA, even pharmaceuticals. And that was our first signal that, that Farm Act was sort of up for grabs. And, it's very bizarre. The main reason that they're touting is, of course, New Zealand's major claim to fame is the agricultural products that it sells. It's commodities. It's beef and lamb and pork and wool and timber, that sort of thing. And so they're saying that the free trade agreement will make it easier for us to access those markets, and it will, and it's absolutely necessary, because there are countries, that will compete with us, that have subsidies or that are in free trade agreements that will compete with us. If we're not in the same system, our products will cost more. But I just look to Australia and look at what they tried to achieve out of AusFTA, the Aussie free trade agreement. I mean, I don't know that they've got any more beef into America, have they?
I don't think so.
I don't think so.
So what can you say to Americans, the American people, about your concerns and the future of healthcare for people of New Zealand, the people of America, the people of the world? Because it seems like the United States is really pushing our system onto your country and other countries in Asia. Yeah,
well, I said something, last time I was asked this by a journalist, I said, quite frankly, USA, bugger off. She reported it. So maybe...
You're just about careful now.
It's not equitable. I don't think one of the main gripes that I have with the TPPA is that it's only going to work at a federal level, and for countries like New Zealand. So in other words, all your states will be able to make their own sort of rules, whereas countries like New Zealand that don't have a state system, we're caught every which way. In terms of health, I think America should look at, making sure that all of their own people have at least access to basic primary care. And I don't think, health is not a tradable commodity. We should...
Okay, thank you. Are there any other? Thank you very much. People appreciate the presentation. I think it's really critical that there be more collaboration, communication on a global level to defend healthcare as a basic human right for all people against these multinationals, these drug companies and other entities. And as we were discussing earlier today, or this evening, even a U.S. Senator, Ron Wyden, who was on the committee who was supposed to look at these agreements, has not been able to get the documents.
Exactly. Yeah, I've read that too.
So, I mean, this tells you it's a completely secret agreement, not just to the regular people, but even to the politicians who are responsible for voting on it, so, except for the company representatives of Pfizer and these big companies. So what is the labor movement the nurses union and other unions in Australia doing to stop this TPP agreement?
Well, we're, continuing to write to politicians and health committee. We're continuing to, protest when we can to bring up the issue and to talk to, all of the health sector organisations, etc. That, we kind of feel a little bit helpless about it, really, because, as you say, it is so secret. And I have to say that that's something that really has rung a bell with New Zealanders, even if they don't like the TPPA. One thing that they absolutely hate about it is the fact that, American lobbyists have access to the text that we don't have access to. That really doesn't go down very well here. We're just joining with our colleagues overseas in Australia, the Public Health Association, other unions around the world, to voice our concern, really.
Okay, well, I want to thank you very much for joining us, and we really appreciate this opportunity to listen.